Hi, everyone. Welcome to the Maine State Breastfeeding Coalition Connecting the Dots meeting in September. So good to see everyone here. Hopefully you can all see my screen and you can see that the plan for today for our 1-hour meeting is to start with this welcome and to review our agenda. And then I will spend a few minutes, actually, we'll call this an executive director report instead of a board of directors report, unless Patrick or you happen to have something planned already. We're still adjusting our terminology on everything right now. And then we will spend the bulk of the meeting connecting the dots. And what that means is essentially networking and sharing and giving everyone a chance to introduce themselves and share what's going on in your world. And if you also have any other updates, anything that's legislative related, or if you have any questions that the rest of us could support you with. I know that a common question I've been getting lately is, how do you become a lactation consultant? And how do you get hours and all of that? So maybe that's something we could talk about today if anyone would like to bring that up. We can talk about any common challenges that might be coming up. You know, are you seeing a pattern in the families that you are working with that has been especially challenging that we can brainstorm some ideas or maybe share some resources on? And then we'll wrap up at the end with what we're taking away from the meeting. One thing that I will put in the chat box is the shared Google Doc that I have already put a lot of notes in, and I'll be referring to when I give an update. And you are also welcome to add your own notes in as well. So there's a section of parent resources and educational opportunities. And if you have access to this document, you can just paste and copy right into that document for everyone to have. You can also drop those items into the chat box and we can move those on over as well. This is also a document that I'll be keeping some notes in when the rest of you are introducing yourselves and sharing resources or questions. I'll be taking some notes in this document as well. So hopefully you all can have access to that and can utilize that as a resource. Okay. So let's go ahead and get started with a bit of an update. First, I want to thank our sponsors. We have new annual sponsors for this upcoming year, and that's Acceleron, Soft Quarter Midwifery, Dirigo Pediatric Dentistry, Brandy Rogers, and a few Maine health programs, including the Barbara Bush Children's Hospital and Let's Go. Also Martins Point Healthcare. And this year we have monthly sponsors. So August we had Root to Rise Physical Therapy was our monthly sponsor, and in September it is Coastal Pharmacy and Wellness. And so we want to thank the sponsors for their support. And I'll give a little bit of an update on our committees. So our advocacy committee hasn't met this summer. We took the summer off after a really busy year with paid leave and donor breast milk, and we're continuing to stay updated on all of these initiatives at this point, and we'll start meeting up again at the end of this month. So if that's a committee you're interested in, then please join us. I can give an update later on about paid leave as well. Our events and fundraising committee was really busy over the summer preparing for National Breastfeeding Month and World Breastfeeding Week. We were really excited that Governor Mills signed a proclamation for August to be Breastfeeding Month in Maine, and that was a really fun thing to be able to make happen. We also put out a call for art, and we received a couple of submissions that are really beautiful, and I will be putting out more soon. We also shared out an equity and lactation scholarship. Patrick, you're welcome to share more about that, but the link is there, and I think I have an image that I'll scroll down to in a moment. We also rolled out a Droplets of Wisdom educational campaign, and Robin, I see you're here. Robin wrote the majority, if not all, of these Droplets of Wisdom, and so maybe Robin, you can share a little bit more about that when you introduce yourself. We also rolled out part of our workplace toolkit, and I see Ashley is here from Let's Go, who's helping to lead this work, and Ashley will give a little bit of an update on that too. We also did some fundraising and friend raising and raised almost $700 throughout the month. We also recently received a $500 donation from Harvard Pilgrim, which was really exciting to receive some support from them, and we'll be thanking them more publicly soon. And we have also received interest from quite a few people who are interested in serving on our board and as volunteers. So it's we'll be making a decision about board membership tomorrow, but volunteers, it's a kind of a rolling opportunity to join any of our committees or help with other activities. We also opened our first store through TeePublic, and you can check that out. You can scan that QR code if you don't have the actual link right here. Thank you, Patrick, for dropping that in the chat box. Perfect. And also our event in May, some of you may have been able to attend our Patchwork of Parenthood event. If you didn't, you can view the recording with a $10 donation. So you can donate through PayPal if we see it's a $10 donation or more, and we see a note that says, you can also do it through Venmo, that says Patchwork of Parenthood, or letting us know that we should then respond with a link to the recording, then we'll do that. Our workplace committee, as I mentioned, has been really busy with our employee return to work resource tools and resources. So stay tuned, you'll hear more about that. There's an image about our equity and lactation education scholarship. And our communication committee has been busy with lots of social media posts and communication and newsletter communications throughout August, as well as some blog posts. And we are starting to develop a professional development committee. So if you're interested in that, please let us know. You're welcome to just make a note drop a note in the chat box with your email address, or fill out our volunteer form to let us know that that's something you're interested in. And that committee will be looking at finding speakers for our educational webinars, and also our a future conference we hope to be hosting. So we would love for some more help with that. Thank you. And then if you're interested in donating, it's never too late to donate or host a Facebook fundraiser or anything like that. There's information in this document about ways you could do that as well to help us continue this work. And any questions about any of that before I move on to our next section of the meeting, or anything else that anyone here might want to add who's working on any of those things? Okay. We will continue on. And in this section, I know that some of you might be multitasking or eating and have your cameras off for good reason, but it is really nice to have cameras on during the networking part so we know who's here, and especially when you are sharing, if possible, to have your camera on. So I just want to give a heads up that at least when it is your turn, and the way we'll do this, once I share a few things, is I'll go through the participant list and I'll essentially call on you, and it's in alphabetical order. So I will plan on calling on you, and if you don't have anything to share or ask, you're welcome to pass. That is fine too. Okay, so I want to share that our one continuing education resource that I've included in this document, there's so many educational resources out there that I try to put out in our newsletters, but one is coming up at our next educational webinars in October, and that will be about pasteurized donor human milk in Maine, and that'll be the Mother's Milk Bank Northeast presenting that. So that'll be really good. Things change, and a legislative update is that now, I think many of us know that last year, Maine Care, a bill passed requiring Maine Care to cover donor breast milk. That program is still being developed, and once we know how to officially access that program, we'll be sharing a lot more about that, but that still is kind of being built out. We'll hear, Kylie will share about that in October. And this year, Representative Stacey Brenner was a sponsor of a bill for private insurance to cover pasteurized donor human milk, which is really exciting. And we will be learning a lot more about that as well, making sure that that is accessible and that's an easy enough process for people to take advantage of. see, got some resources here. And a brief update on paid family and medical leave. I don't know if it had passed when we last met, but it passed. Yay, we can all celebrate that paid family medical leave passed in Maine. And this next year will be what's called rulemaking. So it'll be also building out the program, and that will be happening throughout 2024 with the Department of Labor and what they call a seated authority. They'll be assigning folks to be sitting on this board. Essentially, they'll have listening sessions, and then they will eventually draft some rules that will share what the program will look like. And then the following year, 2025, is when people can contribute to the fund. And then 2026 is when people will be able to start using it. So it's still a little ways out, but in the meantime, there's still a lot of work to do and a lot of education to share about what this looks like and who's eligible and all of that. This link here is a presentation that the Paid Leave Coalition of Maine that was shared at that meeting yesterday. So if you want to know more about eligibility and the status of that right now, you can check that out. And then our last newsletter, if you aren't getting our newsletter, please drop your name in the chat box. We'll be sure to add you. But we posted a lot of jobs that are out there right now, people who are looking to fill positions. So at Maine Medical Center, a certified lactation consultant, and a new position for Maine Med as a certified lactation counselor. So that might be something that you're interested in, or you know someone who might be interested. And I don't know if we have anyone from the North Conway area, but Memorial Hospital is also hiring a lactation consultant. Reddington Fairview is hiring. Sorry for the scrolling here. And then WIC has lots of positions available. I don't know if we have anyone. Well, I see Carrie is here from WIC. Thank you, Carrie. You can share more about that when it's your turn if you would like. And otherwise, yeah, let's continue on, and I'll stop sharing my screen, and we'll start with some introductions, giving you all a chance to share who you are and anything else that you would like to share. All right, so I see Patrick Orr on my screen first, so let's go with our board president, Patrick Orr, if you'd like to share any updates or add anything to what I already shared.
Hey everyone, I'm Patrick Orr. I'm the president and DEI JB committee chair of MSBC. It's really nice to see you all here today. I apologize if you hear my children in the background. I guess the only thing I would share is just to elaborate a little bit on the Equity in Lactation Education Scholarship. It's something that the DEI committee is really excited about. It's specifically for Maine residents who are either current or aspiring lactation professionals, and you have to be a member of a marginalized community. It's specifically to diversify the lactation professional field in Maine. So we're really looking for those people from underrepresented communities. And it could be used for continuing education credits in lactation. It could be used towards just for people starting out on their lactation professional journey. So those seeking their IBCLC or CLC. So yeah, I put the application in the chat. So if anyone knows of anyone who fits that criteria, it would be great if you would pass that on. Something we're really excited about.
Awesome, thank you. Does anyone have any questions for Patrick Orr about that? I hope that you are all brainstorming and thinking, who do you know who might fit those eligibility requirements and might be interested in some educational scholarship support, and please pass that on. All right, let's go next to Alicia.
Hi everyone, my name is Alicia Cutsley. I am the Healthy Eating Active Living Program Coordinator for Oxford County. And an update, which I'm sure I'll have more to share later, is I've been working really hard to get a meeting set up with Stevens Memorial clinical staff, so the lactation consultant, perinatal coordinator, and one of the nurses at the OBGYN office, to connect them with our WIC staff so that we can work together. And there was talks about getting a postpartum support group going through the hospital there. So which would include breastfeeding support and everything. So I'm really excited about that. The meeting is on September 20th. So I'm hoping it goes well and we get momentum and continue to meet. Thank you and happy to be here.
Thank you. Good luck. I'm glad to hear you have a meeting scheduled, and that will only be a good thing. All right, Annie and Johnny. Looking to see who that is. I see an Annie and Johnny in my list, but I'm not seeing the camera on. So if Annie and Johnny are available to share or turn camera on, it's just your chance. One of your chances. And it looks like you went off mute, but I'm not hearing.
Sorry, I have bad connection here, I think. So I'm Annie Barron, and I just, I guess, labor and delivery nurse for 5 years, CLC, and I just I'm actually currently at home with my kids and doing that full time and then per diem in home care. So just really interested in the postpartum world, and that's kind of where I'm going to start focusing all my energy as opposed to the LDRP.
Awesome. What part of the state are you in, Annie? We can hopefully share when if we haven't
Sure.
already.
I'm in Alna near Wiscasset.
Okay. Awesome. Thanks for being here.
Thank you.
All right. And Ashley.
Hi, everybody. I work at Maine Health. I'm a program manager here with the Let's Go program. We're a community engagement initiative, specifically working on healthy eating and physical activity. We have been a part of this network for a little bit of time in this last year, and specifically joined the workplace subcommittee. At Let's Go, part of our role has been over the last handful of years is developing tools and resources that are available and messages that people can use and share within their communities. And we were updating our workplace wellness toolkits and the resources that we have for employees and employers, which made a nice little collaboration opportunity for us to work with more closely with this coalition, Kara in particular, and a few others that are part of this network. So like Kara had mentioned at the beginning, I've been helping to lead the process for developing. We identified 12 tools, which are, it's not every single tool in the world, but at least 12 that we have in the state of Maine that are branded with Maine State Breastfeeding Coalition and Let's Go. And they're really focused to support breastfeeding and pumping families and employees going back to work. 2 of which have been finalized because we kind of pushed them through. You probably saw them in an email. One of which was called Create a Plan to Return to Work, and then a sample return to, so like what you need to think about and what kind of conversations do you have to have with your employer. And we have some additional ones that we're trying to finalize by the end of this month. Things like understanding your rights, pumping checklist, signage for your door when you're pumping, goal template for setting goals around breastfeeding, affirmations to hang by your workspace or in your home, things like that. So like I said, we're also developing a communication plan, which we'll certainly want to bring to this group. But yeah, feeling excited about it. And then we'll start to think about what do employees need in order to be most supportive to employers that are trying to continue and reach their goals around feeding their babies. So any other questions? Or Kara, feel free to throw something in that I may have missed.
Perfect summary. Thank you, Ashley. A lot of time is put into resource development. I don't know if anyone's been part of that, but we're working really hard to get them as right as we can. And if we have time toward the end of the meeting, once everyone's had a chance to share, maybe we can ask you some specific questions, or you can share other feedback or an answer to that question that Ashley just posed, like what else can we do to support employees and include in these tools. So awesome. Thanks for being here, Ashley. Caitlin, you're up next.
Hello, everybody. I'm Caitlin Wright. I'm a public health nurse. I'm out of the Lewiston office covering Oxford, Androscoggin, and Franklin counties. Alicia, I would love to connect for that meeting with you guys next week or on the 20th. That sounds right up our alley. My coworker Janet and I work with Oxford County families, prenatal, postpartum, and that is definitely a big need that we've heard mentioned, postpartum support groups. So that's really exciting news. I love it. I don't have any other updates right now for myself. Thank you.
Thanks, Caitlin. Glad you're here. Let's see. Carrie Louch, you are up next.
Hi, everyone. My name's Carrie. I am with the Maine WIC State Office out of Augusta. I apologize for not turning my camera on. Some of you know I'm currently expecting my first child, and today is the first day of the third trimester, which has hit me like a bus. So feeling a little rough today. I guess the main thing to share on the WIC front, we have a dramatic staffing need throughout the state, as I'm sure a lot of you are facing. It's a big challenge for us, predominantly because we're about to return to our, in some capacity, pre-COVID in-person expectation. Right now, our mid-coast region clinics, so Bath, Rockland, that general area, they have one person that is full-time certifying participants for 3 counties. And if we're not able to find staffing, it's going to severely impact a huge portion of the state that really needs access to services. So we're looking for a breastfeeding coordinator that would manage breastfeeding for the Mid-Coast region, as well as provide nutrition education through appointments. We're looking for a director for that clinic and a nutrition coordinator. So if you happen to know anybody that lives in that area or is interested in working with WIC, especially in a breastfeeding capacity, we would love for those folks to come our way. I think Kara has the most recent job postings. There are, I think there's one job for Western Maine region. I'm sure any of the other WIC folks that are on this call, if there's staffing needs in their area, I'm sure they'll want to talk on that themselves. But that is our main need. So if you happen to know anyone that's looking for work, like I said, please send them our way. And just something exciting to share, if you live in the Down East region, specifically Ellsworth, this Saturday, there is a big community baby shower that's being hosted by our Maine Family Planning WIC office that's based out of Ellsworth. If you do a quick Google, you'll see that there's a lot of press around it. It's only their 2nd annual, but there are some huge prizes, lots of freebies for folks. You don't have to be a WIC participant to attend. So if you have any clients or patients or friends or family that are expecting or recently gave birth and live near Ellsworth, please let them know. Like I said, there's going to be a lot of great resources, raffles, prizes, and it's entirely free. So if that is your jam and you have nothing going on Saturday, highly recommend.
Awesome. Thank you, Carrie. I hope that you get some good rest and feel a little bit better soon. All right, we have Catalina next.
Thanks, Cara. Hello, everyone. My name is Catalina Piedrahita. I'm new to this group. I'm actually not representing any organization. I'm just here to learn more about the coalition and to learn how to become a licensed breastfeeding lactation consultant. Oh, okay, I had this messed up. So I am originally from Colombia. I'm a physician, but I'm not licensed to work in the US. But as part of my journey in this country, I would like to become a lactation consultant. Actually, since I was in my country, I wanted to have that certification. And right now I'm also working towards my degree in public health. So I think this is a great opportunity for me to learn more about all of these and all the organizations in the state. So I'm very happy to be here.
Excellent. Thank you, Catalina. So glad you're here. And what part of Maine are you in now?
I'm in the Bangor area.
Good. There are some fellow Bangor area folks here in this meeting.
Nice.
Great. Thanks for being here. Really nice to meet you. And Cynthia, you're next.
Hi, Catalina. Welcome to the Bangor area. Very nice to have you. So my name is Cindy Grass, and I'm the Public Health Nursing Supervisor in the Bangor area for Penobscot and Piscataquis counties. We're doing a lot of great things in public health nursing right now. We're looking for people, I just wanted to mention this because people are mentioning it. We're looking for people down in the Portland, the Lewiston, and the Rockland area. We're pretty well staffed in Penobscot and Piscataquis and up in the V County. And now down over in the Machias area, we've got a couple of a new nurse that just started a few weeks ago. All of our nurses are either CLC certified or they're becoming CLC certified, with the exception of our TB specialist. Let me see. Carrie, we will be at the event this weekend. We're super excited to come over and participate in that event. We always have a great time at all of your WIC events. They're just so they're so well put on, and I commend you and your co-workers for that. On November 9th, we're going to have a first event, a Penobscot Maternal Child Health Resource event. And initially from 1 to 2, we're going to do a meet and greet. And then from 2 to 5, we're going to be doing individual tables. So anybody that would like to come and set up a table at this event, I'll be sending out an email within the next couple of days. Just reach out to me and let me know that you would like to have a table there and come and meet everyone that is having something to do with maternal child health, because it's an exciting time and there's a lot of great things happening. Thanks, Kara, and it's a pleasure to be here.
Thanks, Cynthia. That sounds really exciting. I'll have to look at my calendar and see what I'm doing November 9th. That's great. Thank you. All right, Erla. I think it's next, if I'm saying that right. Erla?
Yes, you are saying it right. I apologize. There's an issue with my camera. I've been working on it for 2 days. It's like, so I am new to PHN and I am way up by the Canadian border. I'm in Sanegat, Maine. And right now I'm currently working on my my CLC. Hopefully I'll have that finished within the next 3 weeks. That will be done. Like I said, I'm new to PHN. This area is in a lot of need up here. I don't know if most of you are aware, but our OB unit closed at Northern Maine Medical Center. So I'm looking forward to just being in this area for resources for anybody that needs it, and trying to do everything I can so that people are aware in this area. It's kind of cut off from most people, that we are here, we are available, there are resources, and I'm very happy to be in this position, and I'm very excited to be a part of the team.
Awesome. Congratulations. And thanks for being here today.
Thank you.
Can you say again the name of the town you're in?
So I am in, some people pronounce it Sanegat, some people pronounce it St. Agatha.
Okay.
So I'm about 30 minutes from Fort Kent and about 15 minutes from Madawaska. I'm kind of in between, located on an island at Long Lake.
Wow. Very cool. Thanks. Yay for Zoom. Being able
Yes.
to connect with us remotely. Right. Thanks for being here. Really nice to hear from you.
Thank you.
Erica Carlson, you are next.
Hi everyone, my name is Erica. I'm the breastfeeding coordinator for the Bangor WIC program. So we cover Penobscot, Piscataquis counties. Going a little bit off what Carrie said, just hiring wise, we've been pretty lucky at our Bangor location where we are pretty much fully staffed at our location. The only thing we are currently hiring for is a admin position, in which we do have a temporary person kind of sitting in for that position currently. So it hasn't been too bad, but we are currently hiring for a full-time admin. And then going back to World Breastfeeding Week, we did put on an event at our location. We partnered with state and local public health nurses. We partnered with Maine families as well. And it was just a really great event. We had giveaways. We had lots of information for parents. It was open to everybody. State public health nurses was offering car seat inspections and just a whole lot of information for families coming through about the local services in our area. But other than that, nothing else.
Awesome. Nice work. Thanks, Erica. Jen Viget.
Hello. So York County Community Action WIC program. So we serve just mainly York County. We started our in-person appointments at the beginning of August. So we've been doing it for about a month. It's a pretty good transition, so a learning curve with some participants because the majority of them has always been over the phone for us. So it's just a new learning curve for them. Our breastfeeding peer counselor has been attending Southern Maine Healthcare's their Mother Circle group that they host once a week. Our person goes I think the first or the second Thursday of the month. So she's been doing that group at Southern Maine Healthcare. As far as that's pretty much our biggest update is that we've made that switch to in-person. So it's been a learning curve and adjustment for everybody. York County, I don't know if I want to say it aloud, like we're fully staffed. Like, no, you know what I don't even know if I want to say it, but we're good to go. So that's mostly our update.
Awesome. Thank you, Jen. And I have to say, if we offered an award for this, you would be the recipient of attending the most meetings. I think you're pretty high up there on attending those meetings. It's always really good to see you and hear your updates. Thank you.
Thank you.
Okay, I think Jessie is up next.
Hi everyone, I'm Jessie. I'm the public health nursing training specialist with the Maine CDC. This is my first time coming to one of these meetings, and I'm really happy to be here. Really, my role is just supporting our nurses out in the field with their work and learning about trainings and learning about resources. So it's so great to hear the discussion, places we're already plugged in, and then connections we can make. I think Cindy covered a lot of our updates, but I did have something I've been thinking about that I wanted to put out to the group. I don't know if anyone would have thoughts or resources. We don't have any breastfeeding specific trainings coming up, but October is Infant Safe Sleep Month. And we're doing some trainings around that. And I attended a great webinar. I think I might recognize some of your name from that a couple of weeks ago from the National Institute for Children's Health Quality that touched on harm reduction regarding bed sharing and breastfeeding, which I think is such an important topic and something I've been thinking about in building our safe sleep training and those resources. So if anybody had thoughts on that, resources that they've found have been helpful in terms of harm reduction when it comes to breastfeeding and bed sharing, and either want to put them in the chat or reach out to me, I would love to hear what people's thoughts are on that. If anyone's thinking about that too, because I thought that was such a great conversation. And I also just wanted to say a special hi to Annie. Annie and I used to work together down in Damascata. So it's really good to hear your voice, Annie. Thanks, guys.
Oh, that's awesome. I'm so glad you're here, Jessie. Thank you so much for that. And I attended that webinar as well. And I also attended the Safe Sleep Coalition for Maine has a Safe Sleep Coalition that meets and is facilitated through the Maine Children's Trust. And yeah, I think it's definitely a topic that we could talk about. What I would like to do right now is continue on with our introductions. And then if we have some time at the end, we can get into that topic a bit more. Does that sound okay? I want to make sure everyone has a chance to at least do introductions.
Oh, absolutely. Yeah, that sounds great. If we have time, that'd be wonderful.
Thank you for bringing that up. It is definitely an important topic. And I see Robin's comment that Jenna Marion is a board member and recently gave a presentation about sleep and babies. So yeah, Jenna actually recently moved to Massachusetts, and she's a sleep consultant, and she did you're talking about a webinar for us, right, Robin? A Maine State Breastfeeding Coalition webinar. I think it was last year, and it's on our YouTube page. So thanks for bringing that up. All right, let's continue. So Lindsay, not Lindsay Mitsopoulos. Okay, camera's not working, mic's not working. Lindsay Petty from, you're an RN IBCLC at Central Maine Medical Center. Awesome, thanks for being here. This is your first meeting. It's great to hear everything going on in the community. Great, thank you. All right, and if you have any questions or any other thoughts, yeah, anyone is welcome to use the chat box too. All right, so then we are moving on to Lindsay Mitsopoulos. Okay, Lindsay also is in a public space without a camera or mic on the computer. Outpatient IBCLC at Maine Medical Partners in South Portland. You don't have any updates, but happy to be here. Awesome. Always good to see you here, Lindsay. Thank you for being here. All right, and then also in the chat box, Annie is sharing the Safe Sleep 7 that La Leche League has put out. If anyone has that link to drop in the chat box, that would be awesome. Okay, and Marianne Young.
Hi everyone, I'm Marianne Young. I am the brand new public health nurse in Machias that Cindy spoke about. I'm real excited to be here. I'm going to be starting my CLC training shortly. I'm not exactly sure when, but I'm excited to start that. And I will be going to the baby shower on Saturday, and I'm looking forward to that also. And I'm glad to be here. Thank you.
Thanks, Marianne. Glad you're here. Robbie, who is the recipient of the, oh gosh, Robbie, can you share which award, the biggest award that one can receive through the United States Breastfeeding Committee and Petrichor?
I think they called it the Legacy Award.
Legacy
after
Award.
Dr. Rue. Oh, it was two doctors
yeah,
that they honor. Yeah, I'm blanking out too on their names. But hi, I'm Robbie Gonzalez Dow. I'm here just representing myself. I'm new to Maine also. In the last few years, going back and forth from here to California. I'm also a full-time caregiver partner. My husband is very sick. So I hear about all these jobs and I'm like, oh gosh, that I wish I could get more involved. But I'm still working with the California Breastfeeding Coalition and working with supporting our state WIC program and rolling out. They have a new WIC breastfeeding curriculum. And so I'm working with the California WIC program to roll that out and train the 4,200 staff across the state. And so that's what I've been focusing on, that contract that our coalition has. But I am becoming very more connected to Maine. I got my driver's license, registered my car, so I am here, but grateful that I have remote work and hanging on to this job, 20 hours a week while I take care of my husband. But I am a registered dietitian and I have a master's in public health and a CLE when that was their certified lactation educator 100 years ago from UCLA. But I'm looking into getting my licensure here for the RD. If anybody has any recommendations for me, I did go on the site. It looks like I just have to apply basically since I'm already in RD. And just wanted to get to know people more here because I am just really digging in, I guess, building roots. We have family here. My husband's originally from here. But this is my first meeting, and so it's good to see everyone and start to get to know people here.
Yes, I'm so glad you're here, Robbie. And
one last thing, that is this week is the Latina / Ex Breastfeeding Week, or the Semana de Lactancia Latina Week, and there was a beautiful event on Tuesday, people telling their stories, and we had 55 people there. It was really exciting to see. And on Monday, we're doing a closing event, and that's more of a networking event. And I could find the link if people are interested.
Yeah, I put it in the newsletter yesterday.
Oh yeah, oh good.
Coming up. Yeah, I missed the one that happened on Tuesday, but I didn't get it out in time for folks. But yeah, awesome. Yes, happy Latina.
And I'm in New Gloucester. I'm living in New Gloucester.
Awesome. So glad you're here. All right, Robin, you are up next.
Hello, I'm Robin Snyder Drummond. I am an IBC LC in Ellsworth. I have a private practice. I offer office visits, and through the Office of Anchored Women's Health, Kristen Hayward is a DNP and a CNM, and I do the breastfeeding work there. I'm going to also be at the Saturday event, so I'll see you there. And also on November 4th in Blue Hill, there's another healthy hibernation and community resources fair that will be at that as well. I want to say I'm also offering a tummy time class through the Ellsworth Adult Education, and that will be 4 sessions, October 9, 16, 23, and 30.
Oh, you got on mute, Robin.
The tummy time part is like 45 minutes, but the whole thing is 9:30 to 11. And it's a place for moms to come and learn about their babies, or caregivers and parents learn about their babies, and then also learn about tummy time and alignment and baby's development. And last but not least, I wrote the droplets of wisdoms that were posted, and I researched them to make sure that I had backup, and I'm not just talking off the top of my head or from what I've heard over years. You can use those. We're playing a little game on Saturday, Kristen and I, where we're gonna have a little spinning wheel, and people will pick a topic, and then we'll have a droplet of wisdom about that thing. So spread the word, like let's dispel myths and use those droplets of wisdom. My last question is, what would you like to see on the blog? I know that Petricor is going to do one soon, and then Ashley's going to do one soon. So if you have something, I'll put my name in the chat. If you have an idea, let me know. Thank you.
Thank you so much, Robin. So appreciate your help and support of our coalition and our activities. Sandy, you're next.
Hey, everybody. Sandy Fortin with Healthy Acadia. I am a HEAL coordinator, Healthy Eating Active Living under MPN and CDC, handling Hancock and Washington County. Breastfeeding deliverables are brand new to me this year, so I'm still learning, although I raised 2 daughters going through that process as well, and getting back to work in breastfeeding was a challenge 30 years ago. So I am just looking to make connections, looking forward to this tabling event Saturday and meeting more of you in my region. I believe my focus moving forward is mostly going to be with worksite wellness and early childcare centers. So have that event going Saturday, and then we'll be up at the early childcare training September 30th up in Calais. And just want to share one success I had this year was doing a pop-up breastfeeding tent at the Lobster Festival in Winter Harbor. Was well received. We don't have a lot of young families coming to these events, but my dream is that all across the lobster festivals of Maine, there will be a hosted pop-up tent for breastfeeding. So let me know if you want to join on that wagon. Nice to meet you all.
How many lobster festivals are there?
I think there's 12.
Wow.
Rockport's the original one. We see about 1,000 to 2,000 people at ours in Winter Harbor. Wow. Yeah, it's fun stuff.
And Sandy, I have this odd feeling I owe you an email response. So I need to look back at our last communication. So I apologize if I haven't responded.
No worries.
Oh, okay. Awesome. Glad you're here. Thanks. And thank you for doing such awesome work. Sarah Hand, you're next. Oh, we can't hear you. It looks like you're off mute, but we can't hear you. No. Oh man. Okay. That didn't help. I know. Keep trying things. We'll come back to you and feel free to keep testing. If we hear your voice, we'll know that you're ready to go. Otherwise, we might have to use the chat. All right, we'll come back. Let's see, Sarah Young, I just want to recognize, it looks like she had to leave. She's Healthy Eating Active Living Coordinator for Healthy Communities in the Capital Area. She's thrilled to hear about what's going on, currently creating a resource guide for lactation services in Kennebec County for the community. That's awesome. So if you're in that area and you have resources, then go ahead and email her. I'll capture that in the notes too. Thanks, Robin, for sharing your tummy time method info and your website. Okay, Stephanie, you are next.
Hi, I'm a public health nurse down in the Down East region along with Mary Ann. So she's the new nurse. I must be the old one, I guess. I am CLC certified, and I will also be at the Ellsworth thing on Saturday. So hopefully I'll get to see a lot of you guys there. And I don't have really any other updates.
I don't think we know where the party's at on Saturday. That's great. Sarah, still can't hear you. I know you're still testing things out. Keep trying. Trisha, you are next. And I think last, unless we haven't heard from anyone else besides Sarah. So Trisha. Oh, you're on mute. Oh, there we go.
My buttons were going on and off. I don't know why. I like clicked them and they were just like freaking out. So I apologize. My name is Trisha Keogh. I'm a public health nurse with the Maine CDC. I work under Cindy Grass. She was on earlier. Yeah, so I'm a certified lactation counselor. I have only been in PHN for a few months now and just kind of currently taking on my own caseload, but I'm finding my education and resources helpful, and I'm happy to be a part of these meetings and to learn what's out there and to collaborate with great professionals in this area. It's great.
Thanks for being here and congrats. Welcome. No, Sarah, I can't hear you. I can read your lips and hear you saying, can you hear me now? I know. I don't know if you need to jump off and back on again. We'll see you and let you in, or you can use the chat box. But excellent. Thank you all so much for being here and for sharing where you're coming from and the amazing work that you're doing. It's so important, everything that you're doing, and for you to be spread out. I love having such a strong public health nurse representation here too. Your work is so very important. So before we jump into the sleep conversation, I just want to see if anyone else had any other questions that you wanted to put out there to the group before we finish our meeting at 1 o'clock. If there's anything else that you want to share, feel free to unmute or type in the chat box just so I know if we have the last 10 minutes for this topic or if there's something else we wanted to address. All right, Sandy.
Yeah, just being a new HEAL coordinator in this realm, I would love to just have input from all of you who have the long-term experience. How may we best fill in those gaps for you?
Can you say that one more time, Sandy?
Yeah, just wondering if there are particular areas where I may be best of service in filling in the gaps of where you're maybe not making the connections, but I have opportunity to be a technical assistant to reach people. So if there are tips that you want to share that you've seen out on the field, would love to know more.
Great. Can you put your contact info in the chat box if you haven't already?
Yeah.
Great. Okay. All right.
Can you hear me now?
Oh, yes.
Yes?
Yes. Yay.
Okay, I know the meeting's almost over, so I'll be quick. All right, so my name's Sarah Hand. I'm a new public health nurse in Bangor. I am an IBCLC. I used to
I've done labor and delivery and postpartum and, you know, all the OB stuff. So that's where all my experience is. But now I'm doing public health in Bangor. So happy to be here and happy to be back to these meetings. And I think if there's an award for the least attended meetings, I would get that, because I think I've been a member for many years, but haven't been back. It's been like 3 or 4 years since I've been on one. So happy to be back. Happy to see you again, Kara, and everyone else. And Robbie and Catalina, I'm so excited about you guys being in this group and learning from you. And I mean, learning from the whole group. It's a great group of people, but happy to be here. And I'll stop talking now. Just happy to be off mute.
I know. Yeah, it was fixed. Good. Thank you. Robbie, I see your hand up.
There was one thing I wanted to mention. I participate in the United States Breastfeeding Committee Workplace Constellation Group, and they were talking about how to get the information out to employers about the new Pump Act. And it looks like it's going to move where there may be a short video that's made or vignettes where Jessica Lee, who's an attorney with the UC Hastings California Work Life Law, and where she's kind of the authority, or this were some of our ideas, and then having some type of video that just tells employers like, this is what you need to do, because that seems to be what people are asking for. So I just wanted to get feedback, like, would that be useful here in Maine also with the Pump Act?
Absolutely.
In that video.
Yeah. Yeah, and as Ashley shared earlier, we're working on an employee toolkit right now. We'll be working on an employer toolkit next, and that'll be a, we'll have a number of different organizations working on that, I think, and that is something we could add to it for sure. And even without that, we would love to throw that on our website and our newsletter and just share it as widely as we can on social media as well.
Okay. I'll let them know. That sounds.
Yeah.
And I'm happy to review anything. That's one of my areas is, I guess, of expertise, lactation accommodation, and particularly with agriculture, because that's what I did in California when I was at a local WIC site.
Thank you. All right. So Jesse, thank you for bringing up the topic of safe sleep and that webinar that you attended. In the Safe Sleep Coalition meeting I attended, I think it was last week, they were talking about messaging and how to, what to put out there in October for Safe Sleep Awareness Month. And there is the Safe Sleep Maine website, Safe Sleep for Me, something like that. And one thing that I brought up and I would love to see more of is more practical tips for families who are really struggling with those recommendations. That's something that as a group facilitator through Maine Medical Center for the past 12 years, that's something that is a regular topic, how hard it is at night. And just a general nighttime feeding, nighttime parenting resource would be amazing to have something like that, just to guide people through those really difficult, lonely, isolating hours. And there might be some pressure, there might be some fear that comes along with some of the campaigns around safe sleep. And I really like how you use, or your question was really around what else can we offer for risk reduction resources. And I noticed people shared in the chat box about the Leche League and James McKenna. And so I was suggesting and I actually met with Heidi Acker. I'm saying her last name right. Yesterday, we had a great conversation about what are the other opportunities for bringing in, sleep professionals or sleep consultants, people who can be resources, they are aware of breastfeeding and a milk supply. We know not all sleep consultants receive the same training or offer the same support, but is there some way we can let people know that there's help out there? Just we don't tell people you should breastfeed and then call it good. We share the guidelines and the recommendations, just like safe sleep recommendations are shared. But we also say, if you need help and support, go to your local hospital, use your public health nurse, get a home visitor. You know, there are resources and support in the area, and public health nurses and home visitors are still available to help with safe sleep education and dealing with fussy babies and all of that. So I would love to hear from those of you who are working with the families regularly. What guidance do you offer families who are saying, you know, they know about the safe sleep ABCs, but their baby's just not doing it. Baby's just not falling asleep, not staying asleep, off of them or out of their bed. What resources, what guidance do you offer them? How does that conversation go for you? And how, you know, how can we include that in messaging in October? Or is it a really tough thing for everyone else as well?
I think it's a really tough thing for everybody. But another thing that was brought to my attention when, like, I meet with the nurses once every month, and we have, you know, things that they're working on, they're passionate about, they're concerned about, and it got brought up last month by Colleen McCorkle, that she goes, what do we do when, you know, when you leave the home that they're still going to, you know, the baby's going to be in the bed with them? Like, what guidance do we give a parent that, you know, like, yes, we want to direct them safe sleep. That's what we do. That's who we are. And that's what we're promoting. But what do we do, like, to give them suggestions on what to do if, you know, we know that's not going to happen. Like, okay, I know this isn't going to happen, but maybe this would be something you can do to keep your baby safe. Like, just other options aside from, you know, that box, safe sleep, because we know it's still happening. But we, you know, it's just, I just wanted to toss that out there to see if anybody had any input on that.
Yeah, exactly. It happens a lot more than people know, or a lot more than what research probably shows, a lot more than what providers are being told.
Is that okay if I quickly share something about this? I know we're like almost done, but personally, I have a 10-month-old, and we struggled with a terrible sleep regression between months 4 and 6. He was up every 2 hours, no exaggeration. And we were so afraid to co-sleep. We somehow ended up not doing it that whole time. But yeah, I think it's so important to have harm reduction resources out there, because when you look at the you know, American Academy of Pediatrics, it says just don't do that, and it doesn't give you other resources. So I just think it's so important personally as a young mom, and I didn't know where else to turn besides, you know, the safe C's. But I think it's so important to have resources, because it's not safe when you are not getting any sleep either as a parent. So just wanted to throw that out there.
Thanks for sharing that, Alicia. I think, you know, and I know we're at our time, but like, I think stories like that are so important, and really, particularly for breastfeeding parents, but I think for all parents face those challenges. And I know for health professionals, sometimes it can feel like, you know, you have to teach the safe sleep, and then you can kind of renegade, share these risk reductions, and do some more, I can't think of the term, but like, talk to people about what the risks are and how to mitigate them, but you kind of feel like you're going off institutional policy. And I wish it was more above board to say, you might be in a situation where you make a different choice, and here's how you can think about ways to do that more safely. So thanks, guys, for this conversation. I'll put my email in the chat in case anyone else has thoughts or things they want to email after either sharing stories or resources, because I think that's so important.
Yeah, excellent. I know we're at 101 and we're just scratching the surface on this conversation, but I'll allow like another couple minutes if anyone has anything else they want to add.
I think it depends on, I think maybe paid family leave will help with that, because family will have more time to be home. And I think when you're talking about the first month, we have to make a cultural shift for people to understand that napping is actually really healthy, and parents should take a nap so they can handle nighttime. And then when they go back to work, maybe paid family leave will help with that. But I think if you know that family is gonna probably put the baby in bed with them because the baby won't stay in the crib, I think you should just make it really clear, like sleeping on the couch is not safe. Putting them in this car seat on the floor is not safe. So they can sleep on the floor. Give them another alternative that's safe instead of just don't put the baby in the bed. So that's what, just make sure they know about the couch.
Yeah, and the AAP guidance that was revised a couple years ago, I think, did say that the couch and the recliner are actually less safe than the bed, essentially, and that if you think you're going to fall asleep, then to move to a bed that has reduced as many risks as you have, and that's going to be safer. So it can be helpful to review that guideline again too, and see what else they're recommending and what other resources they're offering. Thank you all so much for being here, and we look forward to seeing you at a future meeting and at our webinar in October, hopefully. I think that's what we have coming up. Yeah, and we're after 1 o'clock. So enjoy the rest of your day, and I look forward to seeing you again soon.
Thank you.
Bye.
Thank you.